I'm excited to receive this vaccine. I'll try to be at the front of the line. I'm very comfortable with the safety. I've spent quite a bit of time reviewing the data. We know it works. We have models of other mRNA vaccines that have been tested, and I've done quite a bit of due diligence on looking at the safety and the mechanism and answering all these tough questions. And I know they're tough questions, and I know people have reservations, but I feel very comfortable to receive this vaccine right off the bat. My family, when they're candidates to receive it, they'll receive this vaccine as well, because this is the answer to the pandemic. This is what's going to get us back to some degree of normalcy. So I'm excited to be right up there in the front of the line with our other healthcare workers, and this is going to be a good thing.
I see the consequences of this every day. We've seen the devastation, how it destroys families and communities. I will be second in line because Trotman will push me out of the first of the line. I will take it for my family. I will take this for my friends. I will take this for my coworkers. I will take this for myself. I will take it to end this pandemic.
I'm getting the vaccine to protect myself, my family, and the community.
I've made a lot of tough decisions this year, but getting this vaccine is the easiest one I'm gonna make.
I plan on getting the COVID vaccination. In fact, I'm signed up for the very first day and am giving vaccinations and getting the vaccination. And the reason why I am planning on getting this is because I've read the research, I've looked at the studies, I feel really confident in the science that's behind this. And I want it because I want this to be over. I want us to be safe. I think the more of us that can get the vaccination, when we get up to about 75%, we're going to be able to take these masks off. We're going to be able to get life back to at least a new normal.
I truly believe taking the vaccine is crucial for myself, for my patients, and my community. I signed up for it immediately with zero hesitation.
I just want to help protect our community. I know the more people that we get vaccinated, the quicker we can get to herd immunity and help protect those most vulnerable members of our community, which I think is really important.
I'm going to get the vaccine as soon as I can. I work with COVID patients every day, and I've seen the devastating effects from it, and I want to do anything and everything I can to prevent and slow the spread of this virus.
I'm getting the COVID vaccine because if you've seen the amount of devastation this illness has caused, not only in our own system here at CoxHealth, but throughout the country, it's basically a no-brainer. We know it's safe and it's effective, and it's one of the most important tools we have, along with masking, to mitigate and stamp out this terrible disease.
I'm scheduled to get the vaccine Tuesday morning. I am very comfortable with that. I feel that the vaccine is very safe, and I trust the process. I feel it is our duty to receive the vaccine to both protect our patients, our family, and our community. It is important to get this to help stopping the spread and control this disease. My wife got it just this other day. She's doing very well. I strongly recommend the vaccine, as we really do owe it to our patients, our family, and our community.
You know, taking the vaccine, to me, I think just makes a tremendous amount of sense. We as healthcare providers are really looked upon by the community to take care of them. They receive so much confidence from knowing that their medics, if you will, we call them in the military, are healthy, are safe, and therefore will be there for them. So extremely important, I think, for our community to see that those of us at CoxHealth are stepping up. We've looked at the information, the data. It's very solid. The safety of the vaccine, the efficacy of the vaccine, clearly, I think, makes it a no-brainer that we as healthcare providers really should be leading the way and showing confidence to our community that we're going to be there for them, healthy, ready to work.
I plan to take the vaccine because I'm sick of the pandemic. I'm sick of all this madness. I just want to get this over with. This is the time for us to make a change. As healthcare professionals, we're leaders in this. We need to take the vaccine. The vast majority of people need to take this, and this way the pandemic will end. I'll be taking it Tuesday. I'll be towards the front of the line. I'm ready to go.
I'm going to get the COVID-19 vaccine to set an example for my coworkers, my family, and my friends, and because it's the right thing to do.
Working in the emergency department, I've seen the terrible effects of this virus for many months now, and it can be devastating. We're at a point now where we have a vaccination that can really make a difference in this epidemic. I'm taking the vaccine to protect my patients, my family, and myself. And I think it's going to be safe and effective and can be a game changer.
I'm getting the vaccine because I think it's so important for our community as a way to reduce the rate of the COVID infection. I also think it's very important for our family and friends to reduce their chances of getting COVID.
I plan on getting the COVID-19 vaccine because of one word: science.
And I'm taking the COVID vaccine because I believe it's safe and effective, and I want to keep my patients and families safe.
I'm getting the vaccine to help protect my family and the patients that I care for and the community.
I have chosen to get the vaccine for COVID for a few different reasons. The first one is that the clinical trials and the data review shows a high level of both safety and effectiveness. I also have chosen to get the vaccine so that I can continue to serve the patient population here in Lamar, Missouri, and that we can continue to see patients here in the outpatient setting in primary care.